ഗുഡ് മോർണിംഗ് എവരിബഡി. ഓസ്കി വിത്ത് ബിമൽ എന്ന എൻ്റെ ചാനലിലേക്ക് സ്വാഗതം. ഇന്നത്തെ ടോപ്പിക് ഓഫ് ഡിസ്കഷൻ ഓസ്ട്രേൽ നോസ്കിയിലുള്ള സബ്ക്യൂട്ടേനിയസ് ഇഞ്ചക്ഷനാണ്. സബ്ക്യൂട്ടേനിയസ് ഇഞ്ചക്ഷൻ നമ്മൾ എങ്ങനെയാണ് കൊടുക്കുന്നത്, വാട്ട് ആർ തിങ്സ് യു ഹാവ് ടു കീപ്പ് ഇൻ മൈൻഡ് ഇൻ ഗിവിങ് സബ്ക്യൂട്ടേനിയസ് ഇഞ്ചക്ഷൻ, അതാണ് നമുക്ക് ഇന്നത്തെ ടോപ്പിക് ഓഫ് ഡിസ്കഷൻ. അപ്പോൾ ഇതിൻ്റെ അകത്ത് മറ്റുള്ള സ്റ്റേഷനിൽ എന്ന പോലെ തന്നെ ഇതിൻ്റെ അകത്ത് നമുക്ക് 2 മിനിറ്റ് റീഡിംഗ് ടൈം ഉണ്ട്. വൺസ് യു ഫിനിഷ് യുവർ റീഡിംഗ് ടൈം, then next one is you have to go for you have to enter the station itself. So 2 minutes will be given for reading and 8 minutes will be given for the performance time. Okay, so the first 2 minutes over, the second bell is ringing, you are entering the patient station. As usual, you are going to look for scene safety. Now you have to knock the station and you have to open the door and enter the station. Then you have to look for scene for safety. Safety is deliberately manipulated, so you have to manage that safety. There are so many safety issues will come up in front of you. You have to manage it. Okay. Next one is you have to provide privacy and dignity. Then you have to do the hand gel over there. Then next one is you have to go for introducing yourself. Then next one is you have to ask the patient's name, patient date of birth, confirm with the patient's ID band. You have a cardex given to you, or you have a patient chart will be given for you. Look for a patient's pain and allergy and manage, okay, because patient can present with the pain and you need to manage at this stage. And also the patient will be presenting with allergy, that also you have to manage. The next one is you have to talk to the patient, my purpose of visit. So I am here with the insulin. Usually you will be getting insulin, or sometimes you will be getting enoxaparin, low molecular weight heparin will be given, but most probably recently insulin will be given for you. Okay, so myself is here to administer that particular time insulin is here. Can I proceed? Is that okay? Then you have to look for a few things. One is you have to look for the patient choice. So you look for a site where the patient is happy enough to proceed. So usually upper arm, tummy or thigh will be okay. So if the patient is having choice, look for the choice. Then you find out you have to get permission from the patient and you look around the site and then prompt the site looks okay and happy with that. Okay. The next one is once that is done, then you have to go for another few checks as well. So you have to ask for a latest blood sugar for the patient. So blood sugar will be usually provided in a chit over there, or the examiner will give you a blood sugar there. So any reading above 4 will be okay. If the reading is below 4, you have to deliberately stop the insulin administration because patient is in hypoglycemia at this stage. Next one is you have to prompt your food is on the way. The policy is straight after the insulin, within 30 minutes the patient have to get insulin. Patient have to get food. Thereafter you prompt with the patient, I am going to get the articles and I will come back to you, or I will get the medicine and I will come back to you. Then you have to prepare the tray with the articles. Okay, that's there. Then next one is when you are going to prepare the tray, you have to check the cardex and to find out the insulin and check it and pop it in the trolley over there, or a tray over there. Okay. The next one is you have to do a hand gel and load the insulin. Okay. There is a withdrawal needle will be given to you. So with the withdrawal needle you have to aspirate and then you have to expel the air and you have to attach administration needle, that's there. Then you have to call the second nurse to check in. Okay. So the second nurse will check the cardex and second nurse will check the medicine. I'm sorry, one point I have missed is you have to label the insulin as well. Okay. Then you have to call for a check. Okay. The second nurse is going to check the cardex, the insulin vial and the syringe in which the medicine is already preloaded. Okay. That's already loaded over there. Thereafter the second nurse is happy with that. Then now your job is you have to go back to the patient station. Okay. So once you reach the patient side, the patient will be on the same room on the other side. So once you reach over there, your job is you have to double check the patient's ID with the patient's cardex. Okay, and thereafter you have to explain about the action of insulin and there's usual side effects, what you have to go with what you have to do in case of side effects. So once that is done, your job is you have to get a consent of the patient to lift the blanket and roll up the sleeve and then approach the site. If it's example, if it is a deltoid, it's an upper arm, you go to the upper arm and pinch the area, then take the needle and insert the injection in a dart method over there. Then thereafter what you have to do is, once you have finished, then you take out the syringe Once you finish this, take out the syringe, and the syringe will be straight away going into the shower bin. Once this is done, then you make the patient comfortable. Okay, roll back the sleeve, and then the next point is you have to place the blanket back. The other point you have to keep in mind is you are not using wipes, the alcohol wipes over the tissue, because patient is not immunocompromised. If they say patient is immunocompromised, then you have to use alcohol wipe, otherwise no alcohol wipe. Then once you have done it, then straight away you have to ask the second nurse to sign the cardex. So you sign first, because you are the primary nurse, you sign first, and then the second nurse can sign in as well. Once that is done, your job is give the call bell and say I will stay around or hang around for another 30 minutes. Just make sure that you are perfectly okay. Curtains open, say thank you to the patient and say thank you to the examiner, and then you can come out. So this is the way you are going to do the station over there. It looks like quite simple, but you have to practice it. There are some hidden traps will be there, and the technique will be quite different from our technique of giving subcutaneous injection. The injection strategy is quite different from our point of injection and the Australian point of injection, especially subcutaneous injection. All injections, most of the procedures, how difference will be there. So myself, Bimal, I am one of the lead OSCE trainers in MWT Global Academy, Kottayam. We were conducting OSCE training for Australia, OSCE training for UK, and OSCE training for Ireland for last 2 years. Okay, OSCE training for Ireland is also called aptitude training. So 3 OSCEs in one roof, we have it. So we were successfully with a 100% success rate, and we are the one and only provider for Australian OSCE in India, and myself is the only OSCE trainer for Australian OSCE in India. Okay, I can proudly say with 100% results we are producing. We are giving language support, communication support, and we are giving face-to-face training for 1 week, and thereafter we have extended training program for another 3 days as well. We will be starting training every week from Monday to Friday. If you are interested to join our face-to-face program, you can come back to us. You can contact us any point of time. And also, if you are looking for, if you are stuck over there and you can't come for a face-to-face program, online programs is also available. On top of that, I have a CBT program there. So CBT program is tailor-made. Those who are working, then you can contact us, especially for night class or evening classes or classes during the weekends or something. Please do contact us. We have tailor-made programs available for CBT as well. So with the training, with the proper training, with an experienced hands training, you can win this OSCE in a good way. Otherwise it is a bit hard for yourself, because it's not the practice that is going to happen in our scenario is quite different from the Australian or UK point of view. If anybody is interested for training, please do contact with us. So thank you very much for listening the video. ഈ വീഡിയോ നിങ്ങൾക്ക് ഇഷ്ടമായെങ്കിൽ നിങ്ങൾ ലൈക്ക് ചെയ്യുക, ഷെയർ ചെയ്യുക, നിങ്ങളുടെ ഫ്രണ്ട്സിന് ഷെയർ ചെയ്ത് കൊടുക്കുക, സോ ദാറ്റ് they themselves can have a look into the video. അതുപോലെ തന്നെ നിങ്ങൾ ഈ ചാനൽ സബ്സ്ക്രൈബ് ചെയ്യുക. എവറി ഡേ ഓരോ പുതിയ വീഡിയോ ആയിട്ട് വരുന്നുണ്ട്. We are continuously providing videos in this channel. So at the moment it's going with Australian OSCE as well as Irish aptitude, and also I'm planning to start the UK OSCE as well. On top of that, the charts will be explained for you in a simple way, so it's very easy to understand. If anybody is looking for Malayalam training to be done in Malayalam, we are having a language support in Malayalam as well. But for at the moment I am going to use the English, is it will be helpful for some students who are not good enough in Malayalam as well. So thank you very much for joining with us, and see you next time with another informative video. Thank you.